Hello, my name is Ashleigh Adamek, and this is my presentation for PSYC308 on motivational interviewing. Today I will discuss how motivational interviewing can be used in therapeutic or clinical environments to facilitate a client's own achievement of exercise participation in order to improve one's mental and physical well-being. Motivational interviewing is a client-centered approach to counseling that aims to enhance an individual's motivation by addressing and resolving ambivalence. In this case, ambivalence is used to describe when a person has mixed feelings or opposing attitudes towards a particular behavior change. For example, a person may genuinely wish to increase their physical activity in order to improve their mental health, but they may struggle to carry out or commit to this goal. In practice, motivational interviewing is carried out in two stages. The first stage is building motivation to change. This is where basic counselling techniques are used to develop rapport and create a collaborative partnership between the health professional and client. The second stage aims to strengthen the individual's commitment to change by setting goals and creating a plan for action. During this stage, change talk strategies are used by the practitioner in order to keep the client on track and prevent stagnation. The practitioner will ask questions that focus on a few key points, such as the advantages of changing, their intention and optimism towards change, and also the disadvantages of not changing. Some examples of these questions are: why would you like to make this change? How would you go about it? And on a scale of 1 to 10, how important is it for you to make this change and why? The motivational interviewing approach has been found to be effective because it helps individuals explore their own motivations for change and, on top of that, empowers them to make positive changes in their lives by addressing and resolving conflicting ambivalence. For example, a first-year university student may be struggling to participate in regular exercise the way that they used to due to their new commitments. Through motivational interviewing, the counsellor can help identify the student's goals, find strategies to integrate exercise into the student's busy schedule, and empower them to make decisions aligned with their personal values. The overall spirit of motivational interviewing can be encapsulated by these three principles. Firstly, a collaborative partnership should be fostered in which the healthcare provider acts as a facilitator to assist the client. The practitioner must acknowledge that the client knows themselves best and that they need to be the driver for change. Second, the practitioner should activate the client's own motivations for change. They can do this either by linking health behavior change to the client's personal goals and values, or through eliciting the client's own intrinsic motivation through discussing reasons why they wish to change their behavior. The third key principle of motivational interviewing is honoring a patient's autonomy. This means the practitioner's role is to guide the client while acknowledging that it is ultimately their responsibility to change and that they have the freedom not to act if they wish. For example, a GP works with a patient to create and stick to an exercise program in order to improve physical fitness. The practitioner establishes a collaborative partnership and empowers the patient to take the lead in their own process of change. They would ask the client about their goals and what kind of training they would like to do, and they would activate the client's motivation by discussing how the exercise program aligns with their own personal goals. Throughout the whole process, the practitioner would facilitate the client's process of change and honor their autonomy. In order to implement these key principles of motivational interviewing, we can focus on 4 core strategies represented by the RULE acronym. Firstly, the R in RULE stands for resisting the righting reflex. While health professionals are trained to advise patients, in motivational interviewing they are urged to resist this usual practice. They do this because it is known that when individuals feel uncertain about behavior change, they typically resist persuasion techniques and instead tend to recall the reasons that reinforce their current behavior. Suppressing the urge to list health risks and persuade action allows the health professional to focus on exploring the patient's own motivations for change. This relates to the second core strategy, which is understanding your patient's motivations. This patient-centered approach acknowledges that behavior change is primarily driven by the patient's own motivations rather than the practitioner's influence. To foster change, practitioners should instead explore and show genuine interest in their patients' goals, concerns, and values. The third core strategy of motivational interviewing is listening with empathy. Effective listening is essential to understanding the patient and what will drive success for them. Empathy is beneficial as it allows the patient to feel heard and strengthens the therapeutic relationship. The final core strategy of motivational interviewing is empowering the patient. A patient that actively contributes to their own treatment plan and believes that they are capable of accomplishing their goals will have the best chances of success. In summary, motivational interviewing places the responsibility for change firmly in the hands of the individual, instilling a sense of self-efficacy and determination. Practitioners can create a strong and collaborative therapeutic relationship where both parties work to maintain autonomy and activate the client's motivation for change. Ultimately, the spirit of this approach lies in empowering individuals to unlock their potential for positive change and live in alignment with their true values. This will lead to more fulfilling and sustainable transformations for clients. Thank you.